Spinal bracing is really using braces to help give people stability and pain relief in their spine, the neck, and then the low back. How you can use braces to help people with pain relief and to help people move. I think that what people need to understand is that we want to move people from a focus on pain to a focus on function, and spinal bracing helps us to do that. Well, that's one of the reasons that a lot of practitioners don't use spinal bracing, because in the old days people thought that there was muscle atrophy. I had the unfortunate experience a few years ago. My mother was injured and I became her caregiver. So I learned about the geriatric population not only from myself as a doctor, but as a caregiver. And when you step inside as a caregiver role, you learn different things. And they still want to, the main thing a geriatric patient wants to maintain as much independence as possible. And everyone wants to be able to do something that they can do on their own. And this is what spinal bracing does. It gives people immediate relief and allows them to do some activities of daily living. So to the general practitioner, I would want them to first of all know that they don't cause atrophy and they don't immobilize and they can relieve pain. Right now, a lot of general practitioners are very fearful about the opioid crisis, as you well know, and they don't want to write pain medicines. So spinal bracing will give them another tool that they can use to decrease pain and increase the function. Because if you've ever had pulled a weed in your garden and you did that for a while and you went to sit down, you're like, oh, my back hurts. And what did you not want to do? You didn't want to move. So the one thing we know about people in pain, they feel stuck and they don't want to move. So when you can put that brace on, it's kind of like hugging a bear. When they put it on, they get immediate relief. And that's when you know it's going to work. It's going to be like the light bulb went off. And if it doesn't do that, then that is not an appropriate patient for a brace. And so how good the patient feels when they come and you have something that you can offer them and you don't have to worry about any abuse with a brace. Well, you look at what diagnosis they have, and there are different braces. There are special braces for scoliosis. So you look at the curvature of the spine, and there are special ones for scoliosis, curvature of the spine. There are also special ones for people who have kyphosis, the humpback, the mid-back that's kind of exaggerated there from osteoporosis. And then the other ones come in various sizes, small, medium, large, but you can fit the patient, do measurements, and then you'll know what size that they need. But the key is to give a brace an elastic brace. You want it to have a little bit of a stiffness so that it can help with reducing instability and muscle spasms. What I tell people is, when I bring the brace is, sometimes it looks a little bulky to them. So I tell them to remind themselves of when they went on a blind date, and maybe he didn't look good, but he ended up being a good mate. And so they have to go get over how the brace looked and get into how it feels. And so then I let them put it on, and then they said, you're right, it feels good. Well, I tell them to wear it when they're doing the activities of daily living. I don't want you wearing it when you're sitting around on the couch and being a couch potato. This is to enhance your movement. So if you need it for washing dishes or cleaning your home, working in the yard, going to the grocery store, you can use it then. Studies have actually shown that people who use brace and in conjunction with physical therapy, that their disability index was improved. And so there's no special length of time that each person has to do it, but I encourage them to do it when they're doing their activities of daily living so that they can be productive.